Okay, welcome to episode 102 of an Evolving Man podcast. Today I'm excited to be speaking to Dr. Cate Howell. Dr. Howell is an Australian GP and therapist with more than 40 years of training and experience in the health arena. Her practice and interests focus on the intersection between physical, emotional, and mental health. She is the author of The Changing Man, a mental health guide, as well as 4 other books. Changing Man explores what mental health means for men at every age, from teens to seniors. Welcome, Cate.
Thank you. Thank you for that. And thank you for having me.
Yeah, pleasure, pleasure. So I'd love for you to share a little bit about your journey. How did you get into working, especially mental health, emotional health?
Yeah. I think, I went in the direction of health because I wanted to help people. That was the drive, and that was a value that I developed growing up. And I was, I guess, when I was doing my medical studies, I was drawn to uh, mental health. I really enjoyed my psychiatry terms, but I love surgery as well. And I loved emergency work. So I ended up being a GP. But as soon as I finished my general practice training and my time in the military, I was in the military for a while, I followed that interest in mental health and studied. Initially, it was hypnotherapy for a couple of years. I think as a child, I probably was very curious about things and mostly wanted to learn about people and the world. But I also had to deal myself with what I now know was some anxiety as a child. So I'd sort of worked through a lot of that myself as a child and teen, sort of working out how to manage it. So that was probably an influence too in my mind. But certainly just, wanting to help, being curious. And it was a big part of my work in general practice. So I just pursued it and basically I kept doing whatever course I could find and working more in the area over the years.
Thank you. What a fascinating journey. Wow.
Mm. Been a long journey. It's really been a lifelong journey. Yeah.
Yeah, yeah. What were some of the practices you used as a child to help with your anxiety?
Uh, I would, I remember some of the physical signs of anxiety, the physical things we get symptoms. If I had to give a, a talk or do a reading in assembly at school, my knees would shake. And I guess I learnt to mask it basically. But also I learnt to, my mother would say, take 3 deep breaths before you go on stage, that sort of thing, playing the piano. And so I would try that. And I learnt to use my head talk
Mhm.
as well. So if I was worried about something that had happened, I would say to myself, no point worrying, that's the past. So, I remember telling myself this as a child, no point worrying about that. It's gone, it's done. You have to focus on now. What else? I guess I kept doing things because I wanted to give talks on things and I wanted to play sport. I just kept doing it. So we call that exposure. So even though it was hard, and I might be playing tennis, I could feel the anxiety because of probably expectations, being a bit of a perfectionist. I would just keep doing it. And I think looking back now, I can reflect that even though there may be a challenge, such as the anxiety symptoms, and probably coming from perfectionism, you know, those things can be a problem, but they can also be a driver. They can also help us get where we want to go. And I think probably over the years, I learned to manage the perfectionism a little bit more as well through reading and just working with it myself, basically.
Thank you.
Yeah.
Thank you. You mentioned your inner talk. I notice a lot with my clients and the people I work with is that inner dialogue is very vicious. And I think
Yes.
what you just said about, talking to yourself in a good way, that's the past.
Yeah.
What are some of the things you found in your practice to help with that inner dialogue of
Yeah.
becoming more benevolent rather than hateful?
Yes. It's a huge part of the process and so important. And I think the awareness helps. So being aware of what the self-talk is. And, often we internalize the things we hear, don't we? Whether it's from parents or teachers or coaches. So we sort of internalize some of that. And particularly, the head talk may involve some of the words that those people use, but it may also be ourselves having expectations of ourselves, perhaps high expectations. And if we're not quite meeting them, we'll speak viciously to ourselves about that. So the first step is awareness. And that means we get a little bit of distance. We're stepping back from it a little bit so we can notice what those thoughts are. And then, I guess these days, what I tend to do is think about self-compassion a little bit more. How can we be compassionate? So we're mindfully aware of the thoughts. How can we accept our humanness with our strengths and our weaknesses? And can we be a bit kinder in the words we're using in our self-talk? Like we, speaking like we would to a friend or a child rather than being overly critical, because we say things to ourselves we would never say to anyone else. Yeah. So some of it is that awareness and working with those tools of self-compassion, and some of it's, thinking tools, cognitive tools, but it's practice. We have to do it over and over. So, I remember again as a child, we had quite an academic school, well, very academic school, right from early with exams and with, I remember in grade 2, we were placed in order around the class where we came in the Friday test. So the top student got back left-hand corner and the one who got the worst marks got front right-hand corner. And so I because of my nature and because of that environment, I would be hard on myself in my thoughts if I didn't do okay in the tests or the exams. And I remember saying to myself, if I made mistakes, oh, you're an idiot. And at some point, again, I realized that was not helpful and overly harsh. And so I practiced not saying it. If I went to that thought, if I was tempted to go to that thought, I would be aware, I'd catch myself, and I'd use another thought. You did pretty well. You did the best you could on the day. You can't be perfect all the time, etc. So gradually we create those new habits in our thinking, new pathways in the brain. So it's, a lot of it comes down to neuroplasticity, doesn't it? And creating new ways of thinking, and they become ingrained, just like the old stuff was ingrained. But as the new things become ingrained, the old ones disappear. If we don't use those pathways in the brain, if we don't keep saying those critical things to ourselves, if we're not using it, we lose it. Those things disappear.
Mm, thank you. Thank you.
Yeah.
It's really powerful. It's like Pete Walker in his book Complex PTSD talks about this
Yeah.
idea of thought substitution, so just substituting, and I love that you do that.
Yeah.
I see that, yeah, it's so important. And I kind of question, where did we learn to say you're an idiot? I mean, mine was you're a piece of shit. That
Yeah.
was my way. And it's like, wow.
Yeah. Yeah. Well, children interpret, children are the center of their own world, which is fair enough. as we grow up, we start seeing more around us and, seeing people differently. But we interpret whatever's happening it's in relation to us. So if if you don't do so well in a test, so you're placed somewhere in the class you don't particularly like, it's about you, isn't it? It's not about the system. That was a silly, crappy system.
Yeah.
That was harsh and cruel to do to little children. But you interpret it as, well, it must be me. There's something wrong with me. That's what you're thinking. You don't think, well, the teacher didn't explain it, or this is a silly system. And the same with your thought. Children internalize it as, certain things are happening. It must be that I'm not good in some way, that there's something inherently wrong with me, which is not true. It's not, all children are lovely, wonderful, full of love, full of joy, full of creativity, imagination. They're wonderful.
Yeah. I so agree. There was a study by NASA. Can't remember how long ago. I don't know if you heard of it. They decided to see what young children would grow on to be geniuses. Did you ever hear of that study?
I've vaguely heard of
Yeah.
it. Yeah.
So age 4, they did tests on them and they found out something like 98% of them were geniuses.
Yeah.
And then as they went through the schooling system, it suddenly changed and it went from to 50% when they were age 8, then age 11 down to 20%. By the age 18, it was something like 5 or 4%. So
Yeah.
it's like
Yeah.
this, and I just, yeah, I just so agree that the system is, yeah, they're amazing children.
Yeah, they are amazing. And oh golly, the education system. Yeah. It's, it was designed to uh it was designed to have children there so parents could, work in factories, and it really, yeah, it's hard to, don't get me started on education system. It would be lovely to think it had evolved a long way ahead, but I'm not sure about that. Um, when I wrote The Changing Man with my son, Alex, who's now 30, in his early 30s, and he's a musician. But when we went to one of the schools, when I was trying to choose a school for him, there were a number of different types of schools around the place. And we had an interview, and the teacher interviewing us at one point tipped a cup of pens on the desk and said to my son, "How many are there? How many pens are there?" And my son was about 5, and he had a look, took a few moments looking, and he said, "There's 15." And she said, "Oh, no, 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 you don't do it that way. You have to put your finger on each pen and count 1 to 15. And there were 15. And the reason he knew was when I went to work, he was babysat by a friend's mum who was a dressmaker. And how did she amuse him? Well, one of the things was she had a button box. And she would say to him, "Okay, Alex, you need to get 15 red buttons out. Now you need 5 yellow ones. How many have you got? Okay, why don't you get 20 green ones out?" So he'd been doing that since he was 2.
Yeah.
He didn't need to put his finger on them, but the sister, and I saw him go, "Oh, I'm sorry." Like he was going, "Oh, I've done it wrong." I said to him afterwards, "You didn't do it wrong, my love. You were perfectly correct." And the teacher didn't realise that you'd been counting buttons for about 3 years.
I've heard that. My son, my stepson, he could work it out in his head, and
Yeah.
they thought he was cheating with maths and things like that. And it's like, no, you need to put your your workings down.
Yeah.
And he couldn't understand why he needed to. He just knew the answer and he could work it out. Um, so
Yeah. So it's again, it's letting the individual child be them as an individual, and that they will have different skills. Alex happened to be able to count pens because of the buttons. It didn't mean he had every other skill, but take the time to ask. Oh, the teacher could have asked me how. Tell me about that. How come he can do that?
yeah.
Or
Wow.
the same, with your son, where does that come from? What's he doing? Because the parent knows.
Yeah, 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 exactly. Yeah, I mean, when you were saying there, you know, some of the beliefs there's something wrong with me, taking that within ourselves, it's almost easier to decide that than to think it's someone outside of ourselves. Maybe it's
Yeah,
our parents. So yeah.
yeah, that's right. And often they're authority figures from very early on, the parent or the teacher or the whoever it is, grandparent, etc. They're in a position of power, aren't they? An authority. You need to go to bed now. You can eat this, you can't eat that. That's a no, that's a yes. They're in a position of authority. So, of course, children are going to respond to that authority. It's not till they're older where they start to go, actually, that's weird, isn't it? Mum's not right, or dad's not right, or the teacher's not right. They have to be older to be able to see it differently. But early on, uh, it's very much a different view to adults. It's a it's almost a blinkered view just because of their developmental stage. And I think we have to be very mindful of that. So when different things happen, whether it's a parent being sick or divorce in a family or something, in the education system that happens there, we have to remember how children are perceiving it, that it's different from the adult perception.
Yeah,
Yeah.
yeah, yeah. Thank you. Thank you. So I'd love us to segue into emotional health. And I'd love you to talk a little bit about men's emotional health and then into women's emotional health. If we begin with that, your book, Changing Man, you know,
Sure.
what did you learn? What are some of the issues that
Yeah.
we see?
Well, many issues. And I think it's worth telling this story that really triggered writing the book. So I mentioned when my younger years when I first finished in the hospital system, I was in the Air Force for a few years. And then I went back later, many years later, and did locum work as a GP. And I was working at an army base back in when was it? I think 2016, 17, that sort of timing, maybe a bit before as well. And a soldier came in one afternoon and he had a list of things. I'd never met him before, and he started working through the list of health issues. And then he got to the last one and he said something to the effect of, and I'm not doing too well in myself. And I knew immediately he was referring to mental health, and I knew it was probably related to trauma. He was in his 50s and he'd been in the military a long time. And these days, whether it's British or Australian soldiers, they've often seen deployments. Yeah. So it was related to mental health, and I saw him quite a bit over the next year. And it really struck home that he had been sitting with symptoms for many, many, many years. And it just struck me about how he'd held on to it and not spoken to anyone, and why. Surely that suffering for many years, surely we can do it better. And that's usually the instigator for a different book. It's, this is an area of need. It's like, it's filling a gap, I guess. So that triggered the men's book. And, he and I talked about it as I was writing it, and he kindly read some of it as I was going along with it. So that was the trigger. And so men's mental health, there's a bit of a difference in terms of prevalence rates of different mental health conditions, a bit different for men and women. And, why is there a difference? Is it biological? Is it social? Is it gender related? Is it other things? But men, the rates of anxiety and depression are high. Women, it's a bit higher. For men, substance-related problems is much higher than women. Mm-hmm. And very sadly, suicide rates are higher in men as well. And for women and men both experience PTSD, the rates are higher in women, in fact, because of sexual assault, domestic violence, and so on. So, but we have to look at the rates and go, is that true? Or is it that men perhaps aren't, there are barriers to them seeking help, such as with my soldier. And that is well documented, that there are barriers to seeking help. So some of that is to do with stigma still in the community around mental health problems. Some of it is the stereotypes in the community for men, which are changing. And the title of the book is that things are changing slowly, but more change is needed. So those stereotypes and, about being strong, or whatever that means, physically strong, economically strong, as well as mentally strong. So not weak. And I don't like that language at all. I'm just using it because that's what's out there. And there's perhaps something to do with vulnerability. It's hard to be vulnerable because hopefully things are changing, but certainly even, when my son was growing up, it was very hard for me to watch the socialization at sport and at school of, toughen up and no need to cry and all of those things. So it's, suppress that emotion if it's anything that might be perceived around vulnerability. And we know that help seeking is more limited. The studies have shown that in males compared to women. So actually going to the doctor and seeking help for young men as well. And is that because of the societal influences and the stereotypes, or is it that it's just a bit more foreign for males? Hopefully that's changing too. I mean, for women, we probably go a bit more often to the doctor, and, particularly when we've got children, have to go to the doctor. So perhaps we're a bit more comfortable with it, and we form a relationship with the doctor or doctors, depending on the context. So we may be a bit more likely to say something, and also probably there's not the same gender-based stereotype of saying, I'm stressed. That's okay for a woman to say that. I'm feeling stressed, or I'm feeling, anxious, or I'm feeling a bit low. It's sort of somehow a bit more acceptable for a woman to say that compared to a man. Yeah. So I guess that's a little bit about some of the background to men's mental health. Yeah.
Yeah, that really makes sense. What you were saying there about mental health and trauma,
Yeah,
I'd love for you to maybe talk a little bit about that, the link between the two, because a lot of people, certainly my audience might be carrying some trauma, but not necessarily linking it into mental health or emotional health.
yeah,
So I'd love you to
yeah,
share maybe how that might possibly link.
yeah. So I guess it can link in different ways. Um, it might be that because of trauma in at any stage in life, that one of the things that can happen with when there's trauma is we can become a bit more vigilant, looking for other trauma. So our natural fight, flight, fawn, uh, flock, flop. There's a lot of F's in that response. So our natural stress response is activated. And with significant trauma, it can remain activated. So we remain vigilant. So it may be that we feel stressed, anxious related to that. We may notice it in our body. We may notice it in our thoughts. Even, with that response, we tend to the natural thing with that response is to not be able to think clearly, because we don't, if we're out in the bush and we're fighting a beast, we don't need to think. We just need to fight or run away. So we don't have to think. We don't get quite as much blood to the brain as to the muscles, which is not helpful day to day in the modern world. So it may be those sorts of things that are noticed. But of course, with enough trauma, the person can experience post-traumatic stress disorder, or if it's repeated trauma growing up, complex PTSD, as you mentioned. And of course, our mental health and wellbeing are affected in those, and we're more likely to experience anxiety symptoms or mood symptoms as well. And of course, some of the work on the growing brain and trauma, so in children and teenagers, or infants as well, infants, children, teenagers, the brain is growing rapidly, and particularly at different times. We see it in our own children when they're learning to read, for example, or learning to do maths. They go through a bit of improvement, then a spurt, like a growth spurt, with how they can do those things, and then they plateau off a bit, and then a bit later there's another spurt. Oh wow, you're doing so much better with your reading or your maths. And it's just reflecting, really, it's learning, but it's also what's happening with brain growth. So infants, children, teenagers, lots of brain growth, different times, different rates. But if there's trauma, it can affect what's happening in the brain, and particularly in the emotional center in the middle of the brain. You've probably done some work on that and reading on that with the limbic system and amygdala and hippocampus for memory as well. So trauma can mean that we're a number of things. One, we can be a bit more emotionally reactive, I guess, a bit more up and down because of that impact. But also it can, certain experiences are not properly processed, not put away into long-term memory, so they get triggered, get activated by different things. And for example, if someone has a trauma, for example, they're at a shopping centre, and there's someone there with a weapon, and there's a trauma, then seeing something about a person with a weapon on the news might trigger the same response, or going to a shopping centre, even when there's no danger, that might trigger the same response within the brain. So trauma is particularly complex, I guess, but certainly we know that it impacts with anxiety and with mood and with PTSD, substance-related issues too. Yeah. One of the reasons substance-related issues might be higher in men is, and particularly if there's trauma, is self-medicating, trying to stabilize, how you're feeling through substances. Also, other forms that are related to anxiety. You mentioned hoarding, more obsessional behaviours, those sorts of things may be triggered. And I'm also interested in, I guess we're hearing a lot more about ADHD, aren't we, too? ADHD. Sometimes we see a history of, complex trauma, ADHD, mood, anxiety. Maybe we just see initially the person because of anxiety, and then these other areas we start to sort of be alerted to, or maybe there is some symptoms of ADHD there as well, or symptoms of complex PTSD. And I don't think we fully understand how they all interrelate. But hopefully as time goes on, we'll understand more.
Thank you.
Yeah.
Gabor Mate, I think, wrote a book about the link between trauma and ADHD because he has that himself.
Yeah.
Also, as you're speaking, you mentioned about, the brain and growing. I think Sue Gerber talks about it in her work with attachment theory, saying that we can't grow a flexible brain if we don't have good attachments growing up.
Yeah.
It's
Yeah.
that safety.
We need safety. Yeah. We need safety. And we don't necessarily need to have good attachment with everyone, but we need some good attachments. Yes. Because it's really a mirror too, isn't it? It's a mirror of ourselves when we do relate to someone who gives us that caring and unconditional love. It's a mirror. I'm worthy of it. I deserve it.
Yeah.
I must be okay.
Yeah.
Yeah. So when we're not getting that, again, it's that child perception of, again, it must be me. I'm not worthy of it. I'm not lovable. Even at an unconscious level. We're not necessarily conscious of that at the time or later.
Which is interesting as you speak here. It reminds me of boarding school because that breaking of attachment, a lot of the people I've worked with over the years or stories I've heard it's that sense of I'm unlovable. If they love me, why have they sent me away? And Nick Duffel
Yeah.
talks about that in his book, Wounded Leaders. And it's almost like that part of the brain, the limbic amygdala, is
Yeah.
is put onto that fight, flight, freeze.
It's switched on. Yeah. Yeah. That's right. At that time, because it's, children need safety and security, and being separated and being in a place that's, perhaps not full of unconditional caring. The child's fight flight is going to be activated, and their whole reality has changed.
Yeah. Thank you.
Yeah.
So another area, a kind of a question I had was around why is it that men are often left to suffer in silence? You talked a little bit about that. What have you seen in your clinical work?
Well, I guess a few different things. One aspect of it is that men sometimes present to health services in different ways to women, often more with physical symptoms, for example. And so the health professional is subject to the same sort of stereotypes. So if a man comes in and says, well, I've been feeling tired lately, or I'm not sleeping so well, they're perhaps less likely to be asked about mood or anxiety or trauma than they're more likely to be asked about, oh, okay, how's your appetite? What have you been eating? Have you been doing any exercise, or has that slipped off the radar? How are your bowel movements? Any chest pain? They're going to be asked those more physical things than, has anything else been going on? Have you had stress or worried about anything? Or do you feel happy in yourself, or has your mood been a bit down? The focus may be different, because the health professional as well is with that stereotype of, he's a bloke, he's probably okay. I'm not saying that always happens, but the studies certainly show men present with more physical things, and it's less likely to be picked up if there's a mental health issue or emotional health issue. But also, for women, they can be over-diagnosed. So men and women presenting with very similar symptoms, the men might be, well, he's okay. Whereas the women, they're more likely to be thought of as dealing with a mental health problem. And I just wonder if it goes back to, not that long ago, 40 years ago, when I learnt psychiatry, we were taught a number of significant mental health problems. The teaching was, well, that's the mother's fault. Eating disorders, that's the mother. Schizophrenia, that's the mother. And I'm listening to this going, I can't understand, why is it the mother's fault? But that's what we were taught. You only have to look at films at that time. If a woman was getting a bit, she was crying and, she's in a scary situation, she would be slapped around the face a bit because she's hysterical. So there are stereotypes for women that haven't been helpful as well. But for the man, it can be operating at different levels. But also, that soldier said to me, and I'm not doing too well. And my head immediately went to, okay, this is likely to be mental health. It's likely to be my mind went there straight away. I didn't assume it was, but I said, okay, can you tell me a bit more about what you mean by that? But if the health professional doesn't say that, if they make the assumption, oh, well, they must mean, I don't know what, or they might even ignore it. They might just say, I haven't got time for that today. We've run out of time. We'll talk about it next time.
Yeah, I think,
but it was obvious to me, but it was also not a direct statement. It wasn't, I'm feeling anxious, or I think I've got PTSD, or I'm depressed. It was not doing so well, which you could interpret in a number of ways. So he was very courageous and reached out, said something, thank goodness. But also the health professional has to hear it.
Yeah. So it's almost hearing underneath the surface level of got these physical problems, but actually there's emotional, mental issues there as well. Thank you. Yeah, I was just saying, in the UK, I think it might have changed now, but I think it was a doctor has 7 minutes for with a patient
Yeah. Yeah.
nowadays. It might be
Yeah.
less, but
Yeah.
um,
I've never been able to do that. I have to say. Um,
I don't know how
we
anyone does 7 minutes.
never. I mean, our system here is time based as well, but we have the choice because we have the choice of how long we spend, and so there are many doctors that will say, well, I will have 10-minute appointments or 5 in an hour, or I'll do 15-minute appointments. I'll have 4 in an hour, or I'll do 3 and have 15 minutes to write up notes. Like, you can choose how you do it. But of course, the less you do, the longer you spend, you don't earn the same as the short appointments. So
That's ridiculous. That's
yeah,
what we
so
need as humans, is that connection with other humans.
yeah, so the systems aren't always designed to foster, what we need. But yeah, 7 minutes, you really have to confine yourself to, right, so it's a script today, and, I'll look at the skin thing and that's it. But we're done. You can't even ask about the other stuff.
Yeah. Yeah.
And the patient certainly, is unlikely to bring it up in 7 minutes.
Yeah. So for those of us who might have some, you know, unprocessed emotion, you talked about that 10 minutes ago, this idea, as a child, we've not been able to process it, and
Yeah,
therefore we're up and down quite a lot. What have you found's really helped your clients or the people you've worked with to
yeah,
start to process these things?
yeah. Well, there are different things. So different therapeutic approaches, and it depends a bit on the person, what fits for them, what suits them, and obviously what the therapist is trained in. One thing that really helps is, in the terms of therapy, is the therapist actually exploring with the person, asking questions related to meaning. Like you were saying before, with people coming to the understanding that there's this sort of belief there, for example, that they're unlovable. Or maybe there's an underlying belief there or schema around, what has happened, isn't fair, for example. It's going to vary between individuals. So if we can listen for hints at or obvious meaning related statements, listen for the words, listen for the meaning, and unpack those, that's really important. It's by addressing, that's often where people get stuck. Yeah. So that's helpful. And we can hear those, or maybe through writing. Sometimes with like, as humans, we process things through talking about them, but also writing is really powerful. And for some people, art or music as well. So one of the main sort of forms of therapy with trauma is trauma-focused cognitive behaviour therapy, or trauma-focused CBT, and different forms of CBT. But part of that is the narrative, the writing. Part of it is looking for meaning and working with those related beliefs. And that the narrative work, the writing, is also I guess having exposure. Often we do sort of suppress thinking about it or working through it. So the narrative allows us, once there's a good relationship with the therapist and some safety is established and some useful, I guess, self-soothing skills that can be used to sort of soothe any emotions that, come up that are distressing during the process. You've got to do all that groundwork or resourcing as well, but the narrative can be very helpful. As I said, art therapy, music therapy, there are processes within those. A music therapist can, with their client, write a song about it, compose the music, express it that way. And then we do some of that work in hypnosis as well. If I'm working with a therapist, with a client, then I will use the coping skills for distress, the CBT, the narrative, perhaps dealing with things like flashbacks in hypnosis. But some therapists use EMDR, eye movement desensitization reprogramming, which I'm not trained in. I've thought about it a number of times, but I'm not sure I'll get to it. But I can refer to a good therapist I know, and the patients have found it very helpful in the main. So there's many things that can help. You need a good therapist, and not everyone is trained in trauma. They may have the basics, but they may not have enough understanding or the sort of specific therapy. So you need to sort of look for the right person for you. Yeah.
Thank you. That's fascinating. So we've got
And yeah, the other one, and again, I'm not trained in it specifically, but I have read, some of the work around it. The somatic therapies are growing at the
Peter
moment.
Levine's work.
Say again.
Peter Levine.
Yeah, Lorraine. Yeah, and Jennifer Sweeten's done good work on it and written about it. There's a number of authors now, researchers around the world who are doing a lot of good stuff in that area. And again, because it's not just working with our head, is it? It's not just working with what are you thinking about. It's working with the emotions, and it's working with how we're feeling. Our body. If you imagine, a situation where you are responding, where you are experiencing trauma, the body is responding at that time. So, our body holds that information and memory too.
Yeah, it's so right. I think, Pete Walker, again, he talks about that something like complex PTSD, if we do that, look at it just cognitively, it's
Yeah.
it's complex, so therefore we need to bring in the emotion. We need to look at the physical side of it, the somatic side of it, EMDR. Yeah, love all those different modalities, talking, writing, art, or music. Yeah, many of those I've used myself over the years. Certainly the art, and I used a lot of dream work as well. I worked with the Jungian analyst. I found that
Yeah.
the talking, I put up so many barriers that I could just talk. I couldn't connect to my emotions. The
Yeah.
unconscious, it was like, that's when the tears arrived when I started to listen to my dreams. So,
Yeah. Yeah, dream work's very powerful. I actually did a dream workshop many years ago in London. I was
wonderful.
there in I don't know, about 21, and I was doing some work in a psychiatric hospital because I was an occupational therapist before I did my medical training.
Wow.
So I was there working as an OT, and I saw this dream workshop, so I went and did the training that weekend, and I'm glad I did, because I even now use it. If someone tells me about a dream or ask about a dream, then work through it in the same sort of way. So yeah, dreams are a window to the unconscious mind. Hypnosis is too, we're talking with the subconscious and unconscious mind. So very, very powerful.
Yeah, thank you.
Yeah.
So we're coming up towards an hour. Amazing how
Golly,
quickly
that flew by, didn't it?
it goes quickly, doesn't it? So are there any other areas, maybe women's mental health, uh, some other tools, and other areas you'd love to just delve into a bit?
Yeah. Well, I think well, it's hard to talk about it in, a couple of minutes, but I think with what I've written, I try and be very practical, because when people see me as a therapist, yes, they, the talking is very important and the relationship is important and all of those things. They also want practical tools they can use, walk out the door and use. And so whether that's, various forms of relaxation and mindfulness, whether it's addressing lifestyle, basic lifestyle issues, what we're putting in our mouth, exercise, sleep, those sorts of things, really important. I like many of the tools from positive psychology too. I think they reminded us about well-being and things like, engaging in the activities that are meaningful to us and where we have some enjoyment and passion, and things like gratitude, and working towards being, our authentic selves, and, all of those lovely positive psychology ideas. And, I think the more we understand the various therapies and learn some of the tools, I tend to work in an integrated way. So, and using a whole range of approaches, because one size doesn't fit every individual. And, those having tools from different approaches is really helpful for, all ages. Kids can learn, teenagers can learn. I saw a teenager recently and she went away with, when her mum came back in the room, she said, "Oh, I've got this." She had a page with some, CBT and some ideas, and she was smiling broadly, like, there's a bit of hope. I've got things I can be doing.
Mm.
Yeah. So I don't know if that answers the question really, but
That
there's,
does, yeah.
yeah,
Yeah, mindfulness, I've studied quite a bit of Martin Seligman's work and the positive psychology. And, I do agree that, yeah, we haven't focused enough on, well, how do we bring more joy into our lives? Yes, we take us to a zero from our trauma, -10 to a zero. But then how do I
yeah,
take myself up to a +10, move
yeah,
into joy again? And I
yeah,
almost believe that we have this belief, if I've been traumatized, well, I can't be happy. I'm just going to be okay. But I love what Martin Seligman is like. I think they did some research to show that from 1880s through till, and I think this was in Mathieu Ricard's book, Happiness, saying that 95% of all studies in the medical field had all been on pathology and on depression or mental
yeah,
illness, rather than 5%, which had been about happiness. How do we cultivate that?
yes. And you'll notice, if you have a look at the women's book, that in the title, it says The Flourishing Woman, because I wanted that positive,
Mm.
flourishing word in there, a mental health and wellbeing guide. And the reason that's in there is, even though I was aware of all the positive psychology ideas, I actually went to a course run by a research-based organisation here, called SAMRI, and they train people to go and do training in terms of wellbeing. And they've done some research published, I think, about 2021, and it took this idea of there being a continuum with, well-being at one end, or good mental health at one end, and mental illness at the other. It's like one line. And they said, is it one line? Maybe it's not. And so through their research, they established there's a different model, basically. There's evidence for mental illness being a continuum, some lower level to more severe. But intersecting that vertically is the wellbeing continuum. So
Wow.
a low level of mental well-being, which is psychological, social, etc., and emotional all in there, or a high level. So if we've got sort of two intersecting lines, we want to therapeutically work towards improving, any existing mental illness, recovery and appropriate strategies that help. But we also want to work on well-being, because when we improve well-being, we reduce the level of mental illness. And for a greater sense of well-being, we need to address mental illness. They're both interacting with each other. So well-being, mental illness interact. So that's why I put well-being in the title, because it's about helping recovery from mental illness, but it's also about prevention. So when we work on our well-being, we're also preventing mental health problems. So it makes sense,
It
I think.
does. It
Do the
does.
both, work everything, work
Totally.
on the lot.
Yeah, I hadn't heard of that continuum that way.
Yeah,
That's fascinating. It makes so much
yeah.
sense.
Yeah, it's research by Sam Ree, and the authors, their surnames are very complex. So they're not in my mind, but they're certainly in the women's book. I refer to their research.
Right, right. Well,
Yeah,
well, thank you so much for your time today, uh,
pleasure.
Kate. And how do people find out more about your work, your books? Where's the best place to buy your books?
Well, bookshops should have them or can order them in. Online, any of the big sort of book stores online. My publisher is Exile Publishing. They have them. And then I have a website, and I have all the books and lots of blogs and lots of other resources, meditations, information. I run all sorts of courses for professionals, but also community members as well. So that's Dr. Cate with a C and Howell .com.au.
Great. I will put that into the description so people can go and visit you and learn more. But thank you.
Yeah, I've been building up the website for a number of years now. As you know, all of it
Yeah.
takes time, and you just gradually, keep beavering away in the background, and gradually, there's, like I said, there's blogs there from quite a long while ago now.
Mm,
So, and resources. So it's there's a bit to look at now. Mm.
Well, thank you so much for your work and thank you for your books. There's so many great books out there that you've
Yeah,
written. So, yeah, really appreciate your time today.
thank you.